Anxiety. It's a word we've all heard, a feeling we've all experienced at some point. That nervousness before a big presentation, the worry about a loved one's safety, or the unease in a crowded room. But what happens when that feeling doesn't go away? When it grows, lingers, and starts to take over your life? This is the reality for millions of people living with anxiety disorders. Today, we're going to explore anxiety disorders, what they are, how they affect people, and what can be done to manage them. This isn't just a story about fear or worry, it's a story about understanding, resilience, and hope. Anxiety disorders are more than just feeling stressed or worried. They are a group of mental health conditions that cause intense, excessive, and persistent fear or worry about everyday situations. Unlike normal anxiety, which comes and goes, anxiety disorders can last for months or even years if left untreated. While everyone feels anxious from time to time, anxiety disorders are different. They can interfere with daily life, making it hard to work, study, or even maintain relationships. There are several types of anxiety disorders, each with its own unique challenges. Generalized anxiety disorder, or GAD, involves constant and excessive worry about many things. Panic disorder is marked by sudden, intense episodes of fear, often accompanied by physical symptoms like a racing heart or shortness of breath. Social anxiety disorder causes overwhelming fear of social situations, while phobias involve intense fear of specific objects or situations, like heights or flying. Anxiety disorders are among the most common mental health conditions worldwide. According to recent studies, over 300 million people globally are affected by anxiety disorders. That's roughly 1 in 13 people. Despite how common they are, many people still don't fully understand what anxiety disorders are or how they impact lives. What causes anxiety disorders? The answer isn't simple. Anxiety disorders are often the result of a combination of factors: biological, environmental, and psychological. Biologically, anxiety disorders can be linked to genetics. If someone in your family has an anxiety disorder, you may be more likely to develop one too. Changes in brain chemistry, like imbalances in neurotransmitters, such as serotonin or dopamine, can also play a role. Hormonal imbalances, particularly in stress-related hormones like cortisol, may contribute as well. Environmental factors are another major contributor. Traumatic events, such as abuse, the loss of a loved one, or a serious accident, can trigger anxiety disorders. Ongoing stress, like financial problems or a high-pressure job, can also increase the risk. Psychological factors, such as personality traits, can also influence the development of anxiety disorders. People who are naturally more sensitive, perfectionistic, or prone to negative thinking may be more vulnerable. Additionally, a lack of healthy coping mechanisms can make it harder to manage stress and anxiety. Anxiety disorders can manifest in many ways, and the symptoms vary from person to person. Physically, anxiety can cause a racing heart, sweating, trembling, or even shortness of breath. Some people experience dizziness, stomach aches, or headaches. Emotionally, anxiety often brings intense feelings of fear, dread, or unease. People may constantly worry about things that seem small to others or feel like something terrible is about to happen. Behaviorally, anxiety can lead to avoidance, avoiding places, people, or situations that trigger fear. Diagnosing an anxiety disorder involves a thorough evaluation by a mental health professional. There's no single test for anxiety disorders. Instead, doctors rely on interviews, questionnaires, and sometimes physical exams to rule out other conditions. They look for patterns, how long the symptoms have lasted, how severe they are, and how much they interfere with daily life. To be diagnosed with an anxiety disorder, symptoms typically need to persist for several months and cause significant distress or impairment. It's important to remember that seeking help is the first step toward understanding and managing anxiety. Living with an anxiety disorder doesn't just affect the mind, it impacts every part of life. Personal relationships often take a hit. Anxiety can make it hard to connect with others, leading to feelings of isolation or misunderstanding. Loved ones may struggle to understand why simple tasks feel overwhelming. Work and academic performance can also suffer. Anxiety can make it difficult to concentrate, meet deadlines, or even show up to work or school. The fear of judgment or failure can create a cycle of avoidance, making it harder to keep up with responsibilities. Perhaps one of the most challenging aspects is how anxiety affects self-perception. Many people with anxiety disorders struggle with low self-esteem, feeling like they're not good enough or that they're a burden to others. Over time, this can lead to other mental health issues, like depression. The good news is that anxiety disorders are treatable. One of the most effective treatments is therapy, particularly cognitive behavioral therapy, or CBT. CBT helps people identify and change negative thought patterns and behaviors that contribute to anxiety. Medication can also play a role in treatment. Antidepressants, anti-anxiety medications, and beta blockers are commonly prescribed to help manage symptoms. It's important to work closely with a doctor to find the right medication and dosage. Lifestyle changes can make a big difference too. Regular exercise, a balanced diet, and mindfulness practices like meditation or yoga can help reduce anxiety. Small changes, like getting enough sleep and limiting caffeine, can also have a positive impact. Support systems are crucial. Whether it's family, friends, or a support group, having people who understand and encourage you can make the journey easier. You don't have to face anxiety alone. If you or someone you know is struggling with anxiety, remember, you're not alone. Help is available, and recovery is possible. Let's continue to break the stigma, support one another, and create a world where mental health is treated with the care and compassion it deserves.